Presentation by the Director of Emergency Management regarding the status of COVID-19 outbreak. Scott, are you here?
I am, sir. Good morning, Commissioners.
Good.
Scott Lewis for the record. I'll begin my report today with a fact snapshot. Currently, Nye County has 35 confirmed cases, 6 new cases since this time last week. 19 cases remain open. I'm happy to report that 14 have recovered, and with additional slated to be deemed recovered today after we go through the necessary self-reporting questionnaire and go through the pertinent information as far as their symptomology. There are no deaths to report. However, 2 of our citizens still remain in intensive care and on ventilators in Las Vegas-based hospitals. And currently we have tested over 765 people, which is 133 tests completed since this time last week. We are continuing testing this week, including today, and so we will be glad to report some additional testing results on our next BOCC meeting. For the state of Nevada, we had a total of 4,805 confirmed cases, which is an increase of 868 since this time last week. We also have now 219 deaths throughout the state, which is an increase of 56, and the state has completed in totality of 40,119 tests. We've changed our priority list to a certain degree. Recovery is now becoming a more important issue for us, and we consider recovery from the beginning. However, the emphasis is rapidly transitioning to a higher priority. We are closely evaluating the federal and potential state models for reopening our economy. This is based on smart and factual information. Recall that both considered a tiered approach. However, governors are permitted to open their states using the federal or similar models, and we've seen that going on across the country depending on what they determine their risk factors to be. The Leadership Task Force team is addressing a safe reopening of the economy, while department heads develop a viable and sustainable incremental return to work plan. We have found this to be instrumental in our success. Situational awareness and continuous evaluation is going to be key to our success in reopening. As evidenced by our reporting of new cases, the virus does remain with us, supporting our message that our response is a marathon and not a sprint. This is clearly an issue that we need to be focused on. Even with the reopening of our government, we will still have to have control plans in place to determine hotspots and to have an immediate and effective response to those. Our resources this past Friday, we received 500 swab and 400 medium testing kits. The kits have been distributed to assist with testing requirements throughout the county. We're also holding steady with personal protective equipment. Our emergency service burn rate is in alignment with our access to the equipment, and our emergency service considers all the fire, EMS, and sheriff's officers throughout the county, including our public administrator, whether it be even for search and rescue. All those different components are included in our that plan. However, we have delved into our stock to help support other Nye County departments with upcoming events and special assignments. DEM has also been distributing PPE to external healthcare providers, including long-term health and home care providers as the equipment becomes available. That is, you may recall last week, as part of the change that came forth by the state for us, asking us to re-engage in that approach to ensure the accuracy and the accountability of the materials distributed. DEM has also been distributing PPE to the other healthcare providers and some home health services, so we are working on that diligently as well. The previously identified surge facilities and related medical equipment remains prepared, but thus far we have not been able or have not had the necessity to open or implement the respective plans associated with those facilities. We continue our contact tracing of all confirmed COVID cases. This includes a matrix development to identify and understand our risks. I can tell you that our citizens, for the most part, have been extremely cooperative in helping us get this information and then disseminate it amongst the leadership group to understand where we are, where our potential risks are, and where we need to focus any additional attentions. It has greatly helped us with our testing abilities too, because the more we understand, the more we can request resources and testing kits from the state and federal government. We continue to bolster our back pocket list. You may recall that list is a contingency list of approved vendors for supplies and services. The majority of the ones that we have in our back pocket list are vetted by the state, and so we know they have credibility in delivering the services or the supplies that they have stated. We have also identified the mental and emotional components. We are on regular meetings throughout the week on what we can do to provide that support. And as you may recall, we also have the cooperation with the Nye County Coalition, and we provided the contact telephone number for the coalition last meeting. Our response, the most proven precaution remains social distancing. It remains a proven and prevention model. We can't state that enough. I know the weather is getting nicer out there. People are moving more often. Our larger stores within at least the Pahrump Valley have a significant number of people coming in and out of them. But social distancing has got to be the key. That's got to become our new norm. We also urge caution when traveling throughout the county. Avoid the social gathering. Make sure you take the necessary precautions at fuel stations, food stores, things along those lines. Don't become complacent. This is not the time for it. And we still have our internet and our COVID hotline are still up and running. They're still receiving favorable responses. And, to finish up this report, we ask that you still stay distant but connected with loved ones and make sure that your family and friends are safe throughout the duration of this. This is not going to be done anytime soon, but we can take the steps necessary to help ensure a safe reopening of our economy. End of report. I'm available for any questions.